The human heart is a tireless engine, but when it begins to fail, the signals it sends can be subtle, confusing, or sudden. Statistically, cardiovascular disease remains the leading cause of death globally, and in the United States alone, over 800,000 people suffer a heart attack every year. The most frightening reality is that a heart attack often strikes when you are completely alone, at home, in your car, or at work. In these critical moments, your ability to survive depends entirely on your knowledge and your speed of action. You have only a few seconds to make decisions that will determine the outcome of your life. The first and most vital step is learning to recognize the symptoms early. While movies often depict a heart attack as someone clutching their chest and collapsing, the reality is often much more gradual. The most common sign is chest pain or discomfort, but it might not feel like a sharp stab. Instead, many survivors describe it as an uncomfortable pressure, a feeling of fullness, or a squeezing sensation right in the center of the chest. This sensation may last for several minutes, or it might fade away only to return with greater intensity. If you feel an unusual weight on your chest that does not go away with a change in position or deep breaths, you must take it seriously. However, it is a dangerous mistake to wait for chest pain to occur. Many heart attacks manifest through other areas of the upper body. You might feel a dull ache or numbness radiating into one or both arms, your back, your neck, or even your jaw. Some people mistake the onset of a heart attack for severe indigestion or stomach pain. Furthermore, pay close attention to your breathing. Shortness of breath can occur with or without chest discomfort and is often accompanied by a cold sweat, nausea, or a sudden feeling of lightheadedness. In the medical community, we have a saying, "Time is muscle." Every minute that passes without blood flow means more heart tissue is being permanently damaged. Do not fall into the trap of trying to tough it out or waiting to see if the feeling passes. If you experience these symptoms, especially if they are new or unusual, you must assume it is a medical emergency. Acting swiftly does not just increase your chance of survival, it preserves the quality of your life by minimizing long-term damage to your heart muscle. The moment you recognize the warning signs described in the previous section, you must move into action. The single most important rule is this: call emergency services immediately. In the United States, this means dialing 911. If you are elsewhere, dial your local emergency number. Do not call a friend, do not call your spouse, and do not call your primary care doctor first. Every second you spend on a personal call is a second lost for professional life-saving intervention. Many people hesitate to call for an ambulance because they are afraid of being wrong or making a scene over what might be simple indigestion. As a health expert, I cannot emphasize this enough. It is always better to have a false alarm than a fatal delay. Emergency responders would much rather arrive and find you healthy than arrive too late to help. When you make the call, try to remain as calm as possible to ensure the dispatcher can understand your information. Your speech should be clear and direct. When the dispatcher answers, start by stating clearly, "I think I am having a heart attack and I am alone." This specific phrase is a trigger for emergency protocols. By stating you are alone, you alert the dispatcher that if you lose consciousness during the call, they need to send help to your exact location immediately and potentially authorize a forced entry into your home. Provide your full address or describe your location if you are not at home. Do not hang up until the dispatcher tells you to do so. They are trained to stay on the line with you, providing instructions and monitoring your condition until the sirens are at your door. While you are on the phone, the dispatcher may ask you questions about your symptoms. Be concise. Mention the location of your pain, whether you are having trouble breathing, and if you have any known heart conditions or allergies. If you have any medical history that is relevant, such as a previous heart surgery or current medications, try to relay that quickly. This information is radioed ahead to the paramedics, allowing them to prepare the necessary equipment and medications before they even step out of the ambulance. Finally, remember that the dispatcher is your lifeline. They may give you specific instructions on what to do next, such as how to breathe or whether to take medication. Listen carefully and follow their guidance exactly. By staying on the line, you ensure that even if your condition worsens and you can no longer speak, help is already on the way. You have initiated the chain of survival. Now, your goal is to stay conscious and prepare your environment for the arrival of the medical team. Once the call to emergency services has been placed, there are two critical tasks to perform if your physical condition allows: considering an aspirin and securing entry to your home. These actions are time-sensitive and can significantly impact the effectiveness of the medical response. First, let's talk about aspirin. In the medical world, aspirin is often used during a heart attack because it acts as an antiplatelet agent. This means it helps prevent blood from clotting further, which can stop a blockage in the coronary artery from getting worse. If you have aspirin on hand and you are not allergic to it, taking it can be a vital bridge to hospital care. However, the method of taking it matters. You should chew the aspirin rather than swallowing it whole with water. Chewing breaks the tablet down and allows it to be absorbed into your bloodstream through the lining of your mouth and stomach much faster. Typically, a standard adult dose of 325 milligrams or 4 baby aspirins of 81 milligrams each is recommended. However, a word of extreme caution: do not take aspirin if you have a known allergy to it, a history of internal bleeding, or if you have been specifically told by a doctor never to take it. If you are unsure, wait for the dispatcher's instructions. While aspirin is helpful, it is a secondary measure. Never waste time searching for a bottle of aspirin if it means delaying your call to emergency services. The second task is purely practical, but potentially life-saving. Unlock your front door. When paramedics arrive, every second they spend trying to break down a door or find a hidden key is a second your heart is deprived of oxygen. If you have the strength, walk to the door, unlock it, and if possible, leave it slightly ajar. This serves as a clear signal to first responders that you are the person in need of help and allows them to enter your home instantly. If you have a pet, especially a large or protective dog, try to secure them in a separate room if you can do so without overexerting yourself. This prevents the animal from becoming distressed or aggressive when strangers enter the home, allowing the paramedics to focus entirely on you. Once these tasks are complete, your priority shifts from movement to total stillness. You have done the work to ensure help can get to you. Now, you must focus on keeping your heart as stable as possible until they arrive. After you have called for help, chewed an aspirin, and unlocked your door, your physical activity must come to an absolute halt. This is perhaps the hardest part, as adrenaline and fear will likely be surging through your system, tempting you to pace or panic. However, you must understand that your heart is currently struggling to pump blood through a potential blockage. Any physical movement, walking, standing, or even shifting heavy furniture, increases the demand for oxygen, forcing your heart to work harder and potentially causing more damage. The best thing you can do is find a position of comfort. Do not lie completely flat on the floor, as this can actually make breathing more difficult and increase the pressure on your heart. Instead, sit on the floor or a sturdy chair with your back well supported. Many medical professionals recommend sitting on the floor with your knees bent and your back against a wall or a piece of furniture. This position stabilizes your body and makes it easier for your lungs to expand. Once you are seated, focus entirely on your breathing. You want to avoid the rapid, shallow gasps that often come with a panic attack, as this can lead to hyperventilation and further strain. Try to practice pursed lip breathing. Inhale slowly through your nose for a count of 2, then exhale slowly through puckered lips for a count of 4. This controlled rhythm helps maintain oxygen levels in your blood and can help lower your heart rate. Equally important is your mental state. Panic causes the body to release stress hormones like adrenaline, which naturally increase blood pressure and heart rate, the exact opposite of what you need during a heart attack. Remind yourself that help is on the way, that you have already taken the correct steps, and that your only job right now is to remain as still as a statue. If you have a phone nearby, keep it in your hand or right next to you, but do not use it to browse social media or make unnecessary calls. Stay in a standby mode to preserve your energy. If you start to feel faint, stay on the floor. This prevents a dangerous fall and ensures that if you do lose consciousness, you are already in a safe, stable position for the paramedics to begin their work. As we conclude, there is one rule that stands above all others. Do not attempt to drive yourself to the hospital. It is a common instinct to want to jump in the car to get help faster, but this is incredibly dangerous. During a heart attack, you are at high risk of losing consciousness or suffering from sudden arrhythmia. If this happens while you are behind the wheel, you become a danger to yourself and everyone else on the road. Furthermore, when you drive yourself, you arrive at the emergency room as a walk-in. When you arrive by ambulance, the paramedics have already started treatment, and the hospital is prepared to take you directly to specialized care. Always wait for the professionals. Another common mistake is cough CPR. You may have seen internet rumors suggesting that coughing repeatedly and vigorously can save you during a heart attack. There is no medical evidence to support this as a general self-treatment, and attempting it can actually put more strain on your heart and waste precious oxygen. Your focus should remain on the steps we have covered: call for help, take aspirin if appropriate, unlock the door, and stay still. Once you have moved past the emergency, the focus must shift to prevention. A heart attack is a powerful wake-up call from your body. To prevent a second occurrence, you must address the primary risk factors. This starts with your diet. Focus on heart-healthy fats, lean proteins, and a significant increase in fiber through fruits and vegetables. Reducing your sodium intake is crucial for managing blood pressure, while cutting out processed sugars helps manage weight and diabetes risk. Exercise is your next line of defense. Aim for at least 150 minutes of moderate activity, such as brisk walking, every week. This strengthens the heart muscle and improves circulation. If you smoke, quitting is the single most effective thing you can do for your cardiovascular health immediately. Finally, work closely with your doctor to monitor your cholesterol and blood pressure levels. Keep your emergency medications, such as nitroglycerin if prescribed, in a place that is easily accessible at all times. By arming yourself with this knowledge, recognizing the symptoms, acting without hesitation, and committing to a healthier lifestyle, you aren't just surviving a heart attack, you are reclaiming your future. Share these steps with your loved ones. Awareness is the first step toward a heart-healthy world.